Bernie Maroney has a history of depression in his family.
Take a breath in.
Yoga helps him stay positive, but when the pandemic hit, he had nowhere to go.
And I was going to hot yoga, and it's very hard to replicate that in a home. And I tried, and it failed rather miserably.
That's when Maroney volunteered for a study that gave him a commercial fitness app for free in exchange for having his mood measured through weekly questionnaires.
And you just choose how many minutes you want to do, and you press start.
The study built on decades of evidence showing depression symptoms can be eased by exercise. Timely research as the pandemic took a toll on mental health.
It was really just broadly across the whole community people were suffering. So we wanted to see whether we can support people.
Those doing both yoga and high-intensity exercise reported the biggest improvement.
72% of the ones who were could be categorized as having high depression at the start were by 6 weeks were now below that level. That's quite significant.
There's been enough studies. There is absolutely no question at all.
This psychiatrist has seen exercise work in real time.
You start to get yourself into a regular routine. You start to get out and be outside and doing things.
He says exercise can influence brain chemistry, and he began prescribing exercise to his patients 8 years ago.
Start with a nice easy warm-up.
Those prescriptions became a formal program called Jump Step. It's led by a former patient who says exercise helped.
So when you're depressed, your mind is so busy with negative thoughts and chatter. And when you kind of take yourself out of your mind and into your body doing physical things, you get a break from all that chatter, and it is a good feeling. And step on the tubing.
The BC government has also a good feeling about it. It's looking at making Jump Step a province-wide program. Kurt Petrovich, CBC News, Vancouver.